Former Congressman Patrick Kennedy, son of the late Senator Ted Kennedy and nephew of former President John F. Kennedy, is a vocal advocate for mental health and addiction concerns. His new book is titled Profiles in Mental Health Courage, and he'll be talking about the book tonight at 7 o'clock at Changing Hands Bookstore in Tempe. But before that appearance, we welcome Patrick Kennedy to Arizona Horizon. Good to have you here.
Thank you, Ted. It's good to see you.
Yeah, good to see you as well. This is a follow-up now on A Common Struggle, which was your memoir, correct?
That's right.
But this is a little bit different, and we talked about your uncle there, Profiles in Courage. This is Profiles in Mental Health Courage.
Correct.
Correct.
Well, there's great effort being made to destigmatize these illnesses, and we have made some progress. You see more and more people willing to say that they have a diagnosis or say, oh, I've suffered that too, or I am in recovery, but they don't say really what that means. So I decided in this book to find 12 people, each from different backgrounds, different walks of life, and each with a different diagnosis. And I get them to tell me the story, a deep dive into what it's like to live with these illnesses, how do they deal with relationships in their family, with work. And these are the things that really most Americans don't really know about unless you're one of those who has these illnesses. And if you are, you often don't think that you're making it because it looks as though everyone else is doing better. But the point in this is that these are messy illnesses, they're complex, but we have to have a better understanding of them if we're going to be able to finally tackle these in a comprehensive way.
How did you find these people?
So I know a lot of people in the mental health world. I had the honor of writing the Mental Health Parity and Addiction Equity Act. And that calls for an end to discrimination in insurance coverage for those who are seeking care for mental illness and addiction. It basically says you've got to treat the brain like any other organ of the body, and insurance can't impose any higher treatment thresholds or premium costs or deductibles or all of that, any more so than they would cancer or diabetes. So in the course of all those years doing that, I've gotten to know a lot of people. And what I asked them to do is, could you forward a letter to whatever patients you had that you think are interesting, and we'll see if they're interested in participating. And I got a very diverse group of people.
And you mentioned if they're interested in participating. Was it tough asking these folks these kinds of questions?
Well, I said to them that they could always pull out of the book at the 11th hour, especially after they've read the chapter. Do they think that it accurately portrays their story or not? And a lot of people took me up on it. But I'm happy that we have 12 really good stories, and those people told it all. They and in telling it all, they really help distinguish themselves from their illness. Because you see, most of us conflate who we are to our illness. And by really going into the details of living with these illnesses, you really got to see the person, and then you got to see their illness as two separate things.
Yeah, it's interesting because there are some success stories, correct? And there are other stories where the success is still a little bit there.
Well, these are chronic illnesses, which means, you have progress, and then you often relapse, and you make some progress, and it's challenging because first, stigma means most people don't want to ask for help. 2, if they do ask for help, their insurance plan probably doesn't cover it. 3, if they do get coverage and they get treatment, there's nothing to say that that treatment is evidence-based treatment, believe it or not.
Yeah.
A majority of our treatment in this country, it does not use, if you can believe it, evidence-based therapies, which means you're not getting the cognitive behavioral therapy to a person with an eating disorder, a type of addiction, to a mental illness. There are different types of cognitive behavioral therapy, and they ought to be deployed based upon what your particular diagnosis is.
Is it still kind of an elephant gun approach?
Yeah, we're a one-size-fits-all.
Yeah.
And what we need to do is get, cancer, radiation, chemo, surgery, immunotherapy. You've got a lot going on. But in mental health and addiction, we really don't know, what does it entail? Well, obviously, there's some talk therapy, there's some medication, and there's a lot that has to do with socialization, supportive employment, supportive housing, sober housing. Clubhouse models. By the way, none of that is paid for because we pay for it as a medical illness, but we know this is much more than a medical illness. It's a spiritual malady, psychological. So you have to get all to tackle together in order to get people the best chance of optimal recovery.
And you're also in the book, I believe, it's only been out for 4 days, so I haven't had a chance to look at it, but from what I understand, you're talking to caregivers and families as well?
We've got a number of couples. One of the spouses has the mental illness, and it's a terrific example of what it's like to live with someone who has these illnesses. And we also feature my cousin Mark, who lost his 19-year-old son to suicide. And it was the first time in the last 6 years he's talked about his son's death. And I talked to not only him, but I talked to Harry, who took his life. I talked to his brother, Belton. I talked to Harry's roommate in college. The thing I got from it is that Mark, the father, knew things that the brother to Harry didn't know. The brother to Harry knew things that the father didn't know. The roommate in college knew things that neither one of them knew. And when you started to put it all together, you saw a fuller picture of what Harry was going through. I think that characterizes a lot of these illnesses. I think we have just a very narrow perspective. If we were more open about talking about these illnesses, you wouldn't have people so quiet and so unwilling to intrude, quote unquote, intrude on people's personal space. But their lives could be at risk. So we have to get more comfortable talking about these issues.
And you are obviously comfortable about this. So your memoir, A Common Struggle, is, as I mentioned, a follow-up here. You talked about your struggles and your concerns with these issues and stuff. Did you see yourself in some of the folks you were talking to?
Well, I'm blessed. I'm in 12-step recovery. For me, it means I have not had to drink or drug or use any mood or mind-altering substance since February 22nd, 2011. And I say that because a lot of my colleagues in peer recovery feel like it's a violation of the 11th tradition in a certain 12-step. But if you don't say the type of 12-step recovery you're in, it's fine to say you're in 12-step recovery. And we have nearly 30 million Americans in long-term recovery, but most Americans don't see success in recovery. So they're constantly bombarded with all the negative stories. And I think it's important that you could still maintain your anonymity, but also be an active citizen, which is what I think we need to do more of.
And so, as far as this book is concerned, what do you want folks to take from it?
I want them to not feel as alone, because we're always comparing, ourselves to the outside. But, so many people need to know these are not easy illnesses, but not to feel put down by that, to know that you got to keep up and struggle and keep moving forward. As we say in recovery, we have to trudge the road of happy destiny, which means you got to keep working at it. And I think more people will survive this terrible epidemic of suicide and overdose if we talk earlier, because we don't treat these illnesses till they're a stage 4 illness. If it were cancer, we screen stage 1. If it's a mental illness or addiction, we wait till you're at death's door before we intervene. We have to change that paradigm and go upstream and treat this like we would cancer or any other physical illness, because prevention is the best form of intervention.
Well, you're certainly doing your part. Patrick Kennedy, again, Profiles in Mental Health Courage. Congratulations on this book and, of course, the predecessor there, the memoir. You're doing great work. It must be very rewarding. Thank you so much.
I love what I do. Thank you, Ted, for having me on.
You bet.